Hello and welcome. This is Wasim Afzal. I am going to narrate two cases of Baryta carbonica. One of them is by Rajan Sankaran and other case is by Richardson Bordler. First, let's have a quick introduction of Baryta carbonica. Basically, its mind symptoms are peevishness, irresolute, childish, thoughtless behavior, loss of self-confidence, shy of strangers, and patient of Baryta carbonica is also undeveloped, also have undeveloped brain, easily frightened, and he has a lot of care of domestic affairs. He also has some delusions, and delusions of legs are cut off, and the delusion of as if his friend is going to die or going to be sick. He has a delusion to be laughed at. These are all the key symptoms of mind of the patient of Baryta carbonica. About Baryta carbonica, Farrington says that it is indicated in nervous asthma in old people with aggravation due to wet or warm air. And he says that it should not be given in catarrhal asthma or asthma with emphysema. So we should avoid Baryta carbonica of the catarrhal asthma patient and asthma with emphysema. In old people, Farrington says, in old people, paralysis with apoplexy and paralysis of tongue is also indicated by Baryta carbonica, and it also indicates tonsillitis with formation of pus. Right side of the throat is worse than left, and worse on empty swallowing with enlargement of glands in neck, under jaw, and behind ears. It is one of the remedy to prevent return of the condition of tonsillitis after exposure to cold. Baryta carbonica is also indicated in chronic quinsy. About Baryta carbonica, Rajan Sankaran says that patient of Baryta carbonica has history of frequent tonsillitis and premature aging, baldness of the crown specifically, and loss of memory, hypertension, craving for sweets. Rajan Sankaran says that there are two types of Baryta carbonica patients. One of them is dependent, accompanied by someone who speaks for, and the other is the cobbed up one. Sometimes cobbed up Baryta carbonica patient resembles aurum metallicum because of responsible and care of others, and Baryta carbonica. About Baryta carbonica, Roger Morrison says that the patient of Baryta carbonica has a frequent infection of otitis media, ear pain, often on right side or beginning right and going left, worse on blowing nose, large hard cervical glands, hearing loss from huge tonsils and adenoids, prostatic hypertrophy, prematurely men in their 40s, acne in girls at puberty. Mostly in girls, acne is spotted at face and chest, in Baryta carbonica. And about Baryta carbonica, Farooq Master says that the patient of Baryta carbonica has dry suffocative cough, and his chest is full of mucus, and he has a lack strength to cough, chronic catarrhal states, tuberculosis, late in learning to walk and talk, etc. Hair falls from vertex and mustache, baldness, especially on crown and scalp of Baryta carbonica patients is very sensitive to touch. Fetid foot, sweat, and sole get sore, followed by lameness. Okay, now let's start our first case, which is by Richardson Bodler. Uh, this is a case of Nancy, a 6-year age girl. She received a hamster for her birthday, whom she loved dearly. The mother is delighted to see her girl so actively engaged in play, since she knows of the child's tendency to daydream or not be actively engaged with her toys. When the hamster dies in an unfortunate accident, Nancy's world crumbles and she experiences the first real grief of her young life. The mother is beside herself, too, trying to explain to weeping child that the hamster went to heaven, where she will meet up with him someday. This stifles her tears temporarily, and she begins to look forward to a reunion in the future while she feels that all joy of the present has gone. Mother decides not to buy a new hamster since she wants to avoid tragedies of that sort, while Nancy confirms this decision by insisting that no hamster could ever replace her special friend. Nancy's performance in school, her social interaction, and her motivation to play suffers due to her disappointment that is not coped with. She sits unoccupied, often wishing she could meet her hamster in heaven. The task and toy at hand and even peers seems to give no joy or incentive. She starts as task and or playful interactions and then discontinues since her interest is low. She complains of boredom to her mother, who begins to worry about her daughter. The remedies: clematis for daydreaming, wild oat for lack of interest in play and school, and star of Bethlehem for grief are prescribed. Her additional physical symptoms are tendency to colds and tonsillitis. During cold, there is usually swelling of upper lips, and it was according to mother's observation. Often the glands of her neck are enlarged. She has frequent hiccups and strong dislikes for acids, fruits. Sometimes she complains of a pain or pressure in larynx. Nancy is somewhat small child for her age and appears shy. Nancy was of the clematis type. She was often daydreaming and not actively engaged in play. Temporarily, the hamster had helped her to find interest and stay focused, yet upon the hamster's sudden death, she relieved her former absent-mindedness and disinterest in play in a more intensified way. Since then, more than before, she looked to the future as holding the key to her happiness when reunion with her hamster would happen, and she was convinced that the toys peers and joy the present were worthless. The present held no incentive or fascination, and her mind wandered off into a place within herself where she gave herself to hopes for future enjoyments. Baryta carbonica was the indicated homeopathic remedy for Nancy. Children in need of this remedy may also show stubbornness and a tendency to tantrums. Often they are also shy children that appear small for their age. The remedy is known to give developmental growth, sports in body and mind, emotions when indicated. On the physical plane, Baryta carbonica typically shows, among other symptoms, a tendency to colds, usually accompanied by a swollen upper lip and tonsillitis with swollen glands. There is also strong dislike for acid fruit, a tendency to hiccups, and a pain or feeling of pressure in the larynx. All of these symptoms were experienced by Nancy. Okay, now we will start our second case, which is by Rajan Sankran in his book The Spirit of Homeopathy. In this case, he says that he had a lady aged 36 years. She developed a shoulder pain, might be arthritis, after the death of her neighbor of the same caste. She was not communicative with others in the whole building. The components of her was childish, strangers' presence would aggravate her, bashful, and delusion as if beloved friend is sick and dying, and which indicates that there is so much dependence on a friend. All these symptoms are present in the Baryta carbonica. So Baryta carbonica was prescribed, and she was free of her shoulder pain.